Many times I found myself having questions, am I doing this right? Is this normal for my son?
Usually new parents have a lot of questions about how their child is doing, how the child is developing, and they really want to know how they are doing as parents.
Healthy Steps started out at Advocate in 1997 as part of a national demonstration project that focused on the physical, social, emotional, and intellectual development of young children, particularly in the first 3 years of life. Within our system, we have 3 Healthy Step specialists who are stationed at the sites who work with residents. In addition to that, we have a team at the Advocate Support Centers that focuses on sites and physicians all over the state of Illinois.
The Healthy Steps program screening tools embrace all the different aspects of child development, not only in the child, but also in the parents. It's not just one aspect of the child's development, it's the entire child.
Today at the home visit, we're seeing a family who has a baby who is 7 days old. The baby also has a 3-year-old brother. His name is Eli. So maybe just figuring out, okay.
I would say that Latasha is like a link between the doctor and I. I think it's a good team effort between the two of them. They were really supportive of each other while supporting me too.
Seeing the home environment and speaking with all the family members present is something that you can't achieve at a clinic visit.
I love hearing new things and how to properly take care of my daughter, so it was very helpful to me.
Muy bien, bebé.
I was noticing my son was very nervous. He never crawled, he never liked tummy time. Everything was bothering him. I knew something was wrong with him. Miss Catalina, she was able to understand me and what my worries were.
My role as the Healthy Steps specialist is to be able to promote a close relationship between the families and the primary care providers. We know that early intervention works and is important, so the earlier that we can identify problems, we know that they are going to be developing as healthy individuals.
With my son, the diagnosis is autism. Thanks to her and to Healthy Steps, my son today is so much better. He's progressing every day, every day, every day. And it's because we start very early with him.
The Healthy Steps program is a perfect example of Advocate's nationally recognized approach to care, which focuses on prevention, early detection, optimal treatment of diseases and disabilities, and coordination of care.
We're not just being asked to deliver episodic services. We're being asked to make a difference in the continuum of care that's provided. And in this case, that care is being provided to children.
Every year we train hundreds of physicians, both family medicine providers and pediatricians.
We work with developmental specialists like Catalina. Basically, almost every time I see patients with well-child care, and that has helped me in learning how to identify developmental delay and how to provide resources to parents.
Residents bring these practices to their private practice or other parts of the medical group. The reach is so wide and so vast.
Patient fees and insurance companies are not paying for Healthy Steps services for the most part. Over the years, Advocate has been able to fundraise $15 million for the Healthy Steps program. What we need to do as a not-for-profit organization is look at outside funders. We really rely on them to support programs such as Healthy Steps.
Our focus, and that of several other funders, has been on enhancing developmental pediatric care in Chicago and Illinois. Research shows that a child's brain develops at a rapid pace from the ages of 0 to 5, and their early experiences can have a major impact. An example of Healthy Steps' impact is that practices went from a low screening rate of 0 to over 85%.
We heard about the program and thought we have to be involved. We were excited because it was evidence-based. It's very important to us that we understand the impact that a program will make on disadvantaged women, their children, and people living with disabilities.
The way I have been giving back to the Healthy Steps program is through charitable gifts. Since I had this wonderful opportunity, when I was a first-time mom, that I want to make sure that others have that same opportunity as well.
We want children to be healthy, not just here in Chicago, but all over the state of Illinois.
You can get answers. You can get a lot of help through Healthy Steps.
If we as a program did not have Healthy Steps, our education would be lacking. We would be graduating and would not be prepared to actually address the needs of our patients.
Certainly, prevention and early intervention are much better for children and families and are much more cost-effective than treating problems later.
There is no better example of the impact of philanthropy at Advocate Healthcare than the Healthy Steps for Young Children program.